So, as we have already seen, the starting point is then to develop a conceptual model. You're doing a literature review in order to find the relevant variables. We have seen you can do that with literature, but also combined with qualitative research by doing focus groups, by asking open questions, by doing text mining in order to make emerge the main concepts, the main topics. And in the second step, you have to find an adequate theory. So again, we have to find an adequate theory, and this theory is in relation about what we have already seen for acceptance. So it's a privacy issue theory because mHealth collects a lot of data, which is highly sensitive. That is why there's a theory called privacy calculus theory, which is perfectly fitting to our research. Because on the one hand, privacy concerns create psychological costs that negatively influence consumers' willingness to disclose data. On the other hand, receiving personalized service recommendations creates value, which might reduce privacy concerns. So the increase of personalization and the reduction of cost associated to psychological cost of privacy concerns through trust should increase well-being and should increase positive outcomes. And here you can see it actually. On the one hand, we have privacy concerns that create psychological cost, negatively influencing well-being and willingness to disclose data. On the other hand, we have benefits related to personalization that improve well-being, that create value. Well-being, toujours conceptualized as a personal state of mind linked to different factors such as physical well-being, psychological well-being, health, mainly social well-being, because health apps can connect customers or patients to discuss among them, pleasure, self-realization through sports apps, and last but not least, happiness. And we have another theory, which is the theory of user gratification related to well-being, which we've already seen also in the first part of the seminar, this theory comes from the usage of media, TV, internet, but it can be perfectly adapted to the mHealth sector, because when using media, users try to satisfy different needs and objectives, which are heterogeneous. Cognitive needs, which are actually related to get specific information. Affective needs, which is related to improving happiness. Personal integration needs, which is related to development of performance, for example, through sport apps. Social integration, aiming at acquiring social status, so improving social image, but also being connected with others to support us in difficult situations. Release of tensions, that is to improve our health and our well-being. And if these needs are satisfied, users should adopt the mHealth apps. They aim at increasing well-being naturally, so that is why well-being is, again, a very important variable in our model. Which brings us to our conceptual model. What are the factors that influence well-being when adopting a health app? Yeah, we start with TEM or UTIT model. Perceived usefulness based on literature should have a positive impact on behavior intention to use. And before, in line what we have already seen, perceived ease of use should have a positive impact on usefulness. In other words, the more the app is easy to use, the more it should create utilitarian benefits. The more it creates utilitarian benefits, so in line with the users and gratification theory, the more it satisfies the different needs, the more it should impact positively the behavior intention to use. So here's our conceptual model, before and after use, because here we do a longitudinal study, which we will see in the methodology. So ease of use, usefulness should positively impact intention to use before use and naturally also after use, which you can see here. And we have moderating variables. Privacy concerns should decrease the impact of intention to use. Various well-being personality should increase the impact of intention to use on perceived well-being. So we clearly see here our conceptual model with the different hypotheses which are justified by the literature. And after having established our conceptual model before use and after use, we now show the methodology we used to do our investigation. So the methodology used actually was a survey we did before and after use. So we used the convenience sample with students. They had to give the opinion, the perceptions before using the sleeping app and after using it 1 week. Why a sleeping app? Because it was easily downloadable on the typical app stores or on Google Store. So we asked the students to download the sleeping app, to use it for a week. Before using, we asked them some question with established measurement scales. And we asked them the same question after usage. And we had actually a convenience sample of 180 students. You see the mean age is quite low because actually it's related to students. We used, as we have already seen, existing scales with satisfactory psychometric indicators, namely alpha Cronbach higher than 0.7, so indicating high reliability, Euroscore rows higher than 0.7, indicating high reliability, and high convergent validity because all values are close to 1. And you can see here the scales are coming from actually UT TAM literature, perceived usefulness, well-being coming from existing scales, always measured on Likert scales between 1, not agree at all, to 7, absolutely agree with this statement. Here we have intention to use, actual use, and perceived ease of use coming again from the TAM and UT scales. Privacy concerns, it's also existing scale, and well-being personality is also an existing scale. So it's important to describe the methodology, the sample, to describe the scale, the measurement instruments, and so after having done described the methodology, we now see the results, and we can see here actually the results coming from a structural equation modeling, so regression coefficients. You see actually that in the first indicator is always before use, the gold, so in black, the gold indicator or regression coefficient is after usage. So we can see that actually perceived ease of use, the impact of perceived ease of use on perceived usefulness increases after use. So ease of use is an important variable. We see that ease of use has no impact on intention to use and actual use before and after usage. We see that perceived usefulness decreases from before use to after use and is significant on intention to use. So there's a decrease of before use, people perceive more usefulness, and this impacts more importantly intention to use than actually after use, when people actually do not perceive actually real perceived usefulness anymore. So there's a decrease of this indicator, showing again the importance of doing longitudinal studies where users really experience the technology, because this then enables them to really see if the technology is bringing benefits, more benefits than costs. Here in this case, it does not seem to bring really benefits to them after usage. And we see that's the same also for the intention to use on well-being and actual use a relationship on well-being. After usage, actually well-being is decreasing. So it appears this might be explained by privacy concerns, which are decreasing actually after use, but which are still important. So well-being, the well-being that should be created through good sleeping quality is decreased by privacy concerns. On the other hand, there's one factor, moderator well-being personality, which should increase actually the impact of usage, intention to use on well-being. So the more people are open to well-being through a well-being personality, the higher should be the impact of intention to use and actual use on perceived well-being. So we confirm a certain number of our hypotheses, and we conclude the research actually, and as you have to conclude your research, with the discussion of the results and the contributions. So we confirm that the use and gratification theory can be applied to health apps, mobile health apps, because actually health apps satisfy cognitive needs to get more information, to improve the health. They satisfy personalization integration needs to develop the ability to use health apps through higher perceived usefulness, PU. They satisfy tension release needs in order to release health-related tensions, fears of being ill, because through the mHealth app, people are monitored and can diagnosticate very quickly the disease they have, and affective needs through higher health quality, well-being, and happiness. So the usage and gratification theory is perfectly applicable to health apps, and health apps can be conceptualized through the different four needs of the user and gratification theory. We show again the importance of well-being through the satisfaction of emotional affective needs and release of tension needs. So hedonic value, health, quality of life are very relevant variable, but after usage there's a decrease in well-being because the benefits do not appear high and do not really satisfy customers through the increased self-knowledge, the increased self-management. And the affective needs also in terms of happiness seem to be insufficient. So if you again consider a balance between perceived benefits and cost, the perceived cost of privacy seem to outperform the few benefits which are given by the mHealth apps. We emphasize the importance of well-being personality as a segmentation variable because the more people are open to well-being personalities, the more actually there should be impact on actual usage. And we emphasize the importance of privacy calculus theory and privacy concerns that reduce actually the impact on mHealth apps on well-being before, and it even decreases after use. So this is consistent with the paradox of privacy personalization or the privacy calculus theory which we have described, because even when users perceive privacy concerns, these concerns diminish. And if the benefits of the personalization outweigh the cost of privacy loss, people do not perceive value. Therefore, users are likely to provide information only if the benefits of personalization are greater than the risks of data disclosure, which does not appear to be the case in our research. And to finish the managerial contributions, we show the importance of the concept well-being. So it's a very important concept next to satisfaction, an effective concept impacting usage. Privacy concerns remain the primary reasons for reluctance to share data and to adopt smart health, mHealth apps. So we need data policies to increase trust. And it's important to identify customers open to mHealth apps through high well-being personality. It's a scale that we can use to measure this personality. So this would be a good segmentation criterion that would fit to better target mHealth apps. And as no research is free of limits, and giving us opportunities to develop further research directions, so we only use a sleep application, so there are other mHealth applications, so might be interesting. We don't really real usage data, real behavior data for health improvement. Our test period is quite short, only 1 week, and our sample is not representative because it's a student sample. So future research avenues would be to replicate the study with other types of health apps, for example, pure mHealth apps for obesity, diabetes, heart diseases, in order to really see if well-being increases through these apps. Another avenue of research direction would be a collaboration with real app providers to obtain real usage. Again, to cope with the difficulties between declarative scales and real behavior, because we know that what people say is not necessarily what they do. A longer duration test, so several weeks or even months or perhaps years, would be interesting to see if these indicators fluctuate, decrease, improve, if well-being actually increase over the time or decreases over the time through the data collection or through actually lack of ease of use or other variables. And last but not least, we need more representative samples of the population, because actually we only work with a student sample, even if students are the future target groups for all these technologies. So It's not a big deal in our publication, but it would be good to test our model with other more representative samples in France or other countries in Europe or other continents. So these are our limits and research directions. And I would like to do an overall conclusion. So first of all, it was important today to understand that what are the hot topics in marketing research related to technologies, related to consumer well-being, related to your AI, IoT, big data, personalization, so the bright sides of these technologies, but above all also the dark sides, giving a lot of research opportunities which are conceptualized in the hot topics of research, of marketing. That is, I would recommend you to look always to the hot topics in marketing in order to see if you find an adequation between your research topic and the topics, hot topics in marketing. The second intended learning outcome today was to show you what are these disruptive technologies, how are they used, IoT, AI, smart city, smart home, autonomous vehicles, and what are actually the cognitive, affective and social acceptance factors that might influence the adoption of these technologies. Here we saw different theories, so mainly we saw the UT and TAM technology acceptance theories, which are very appropriate to conceptualize technology acceptance, but only from the utilitarian point of view. That is the rational point of view. So it's important to enhance, like a Lego system, these theories by using other theories. For example, we use the transformative marketing, consumer research theories about user gratification. We use the regulatory focus theory, which conceptualizes that users actually take decisions based on utilitarian, but also on effective well-being based objectives. We introduced perceived service quality theories, which might explain why service robots, chatbots, autonomous vehicles might create value, how they create value, and how this impacts purchase behaviors and adoption of technologies. And we saw above all perceived risk theories. Perceived risk about technology risk, that technology harms the health, psychologically, but also physically. We saw that trust is an important variable by integrating trust theories. We saw the technology risk theories, perceived privacy concern theories, so privacy issues which emerge through the data collection. And we saw ethical issues, ethical risks, which emerge actually through AI, because they replace more and more our human beings, and therefore it's important also to integrate ethical issues or ethical risks. So in summary, it's like a Lego system. We have the UT as a basic, well-founded theory, which is enhanced with other well-founded theories, taking into account other aspects of technology acceptance, as we have seen. And last but not least, well-being is a very important variable which should be considered by marketing managers, next to satisfaction, next to loyalty, next to trust. So it's important to conceptualize well-being in research, because it's also a hot topic in research for marketing research, and so in the hot topics agenda. And and last message is also you can work on the left side of the model, antecedents of adoption. But it's also interesting to work on the consequences, not only measure to stop yourself at the intention to use of the adoption, but also what happens after the adoption. And namely, this is what we saw in the last study, the impact of technology acceptance on well-being. So in summary, you have all the articles for the different technologies. I invite you, if you're interested, to read them in detail, to dig deeper into the details of these studies. And if you have questions, don't hesitate to come back to me. I invite you also to connect yourself to my LinkedIn profile so that we can stay in contact. You see here also my latest research, which I publish always every time on LinkedIn. And you have my email address. I'm looking forward to discussing with you about these different research topics.